Hey, thanks so much for joining us. Today we are continuing our series on sleep apnea. And of course, I am joined as always by Dr. Daniel Cheros. Doctor, thanks for being here.
It's a pleasure.
So sleep apnea, the early on phases of diagnosing this, everybody kind of knows you have to do the sleep study. We've talked about it a little bit, but can you talk a little bit more about what exactly this sleep study entails?
So for the most part, when we order sleep studies, these are going to be at-home sleep tests.
Okay.
Patients can have them done in a sleep lab, but for the most part, people are going to start with an at-home test.
And it seems like it'd be a lot more effective at home where you get to see what's going on when people are in their natural habitat.
It's so much easier and so much more convenient for the patient to do when they're sleeping in their own bed in kind of their own natural circumstances with their own pets and bed partners.
Yeah, they're probably so much more comfortable. But when I think of a sleep study, I'm just kind of like picturing this big contraption and like some sort of mask or something on you. But it's not really like that anymore, right?
Exactly. So this isn't like Frankenstein where there's whole arrays attached to your head necessarily.
Okay.
So really, you're sleeping in your own bed. There's going to be a strap around your chest. There's going to be a little, basically an oxygen cannula that loops under your nose, kind of behind your ears. And there's going to be a little probe on your finger. And I kind of think about it like this. Have you ever fallen asleep in your clothes by accident?
Yes, that's actually the best time to fall asleep. That's like the most authentic sleep that you get.
Exactly. I think this is probably less obtrusive than falling asleep in, say, your jeans.
Oh, perfect. Yeah, so you're going to be able to get a good grip on what's happening here. You're going to be able to really be able to know what this patient is going through. And tell me a little bit about how that information is used and why you need those three different tools.
And so what we're doing is we're measuring a few distinct things. So that chest strap is going to determine whether the lungs are even trying to expand in the first place. The oxygen, what we call a pulse oximeter, is going to be on the finger. That's going to detect how far the oxygen level is dropping. We call that a desaturation, and for how long. And then the cannula underneath the nose is going to detect also airflow. Okay. So if we see the chest move, so it might detect movement of the chest, that means you're trying to breathe, but there's no airflow. That, by definition, is an obstructive event.
And all of this is really step one in improving a patient's life, and they're going to start feeling so much better after they're able to be treated.
Well, you can't improve it until you know what you're dealing with and how bad it is.
All right, great information. Doctor, thank you so much as always, and thank you so much for joining us. We'll see you next time.